right, welcome, Youth Voices on Mental Health. We have a wonderful hour to give to you some information. Our guest presenter today is Sridevi Swaminathan. I hope I said that right. And then we have a panel of three young people here to provide us some insights on their perspectives of mental health. We have Nihar Patel. Did I say that? Yeah. So many stories about Nihar, especially the first time I met him on his name tag. Not only did he write his name, but he wrote the pronunciation underneath it. That was just great. Um, we have yeah, yes, and then we have Devon. So thank you to the three of you for being here today and providing us with some insight into Gen Z and mental health. And we'll go ahead and get started. Take it away, Sridevi.
So hi everyone, my name is Sridevi, as I said before, and I'm going to be talking about the importance of youth voice in mental health and substance abuse. So a little bit of background, I'm originally from Michigan, but I came to the Great Ohio because I go to the University of Akron. I'm in a 3+4 undergrad medicine program, so what that means is I do 3 years of undergrad and then 4 years of med school, no MCAT guaranteed, which has been pretty fun. So I'm going into my 2nd year of undergrad this fall. So a little bit about me as a high school. High school is really where I started following my passions, and whether it be that for prevention or medicine. But in high school, I was a dedicated volunteer. I loved hanging out with my community. Every Saturday, I would volunteer at a language school. I was on my school swim teams, varsity swim team, varsity synchronized swimming team, and I also did powder puff for fun, which is when girls play football and guys coach, and then guys play volleyball and then girls coach. So that was fun. I did a lot of Molly Nations work ever since I was in 6th grade, and I think this really helped me get into policy. It really interested me in the world of government. So the picture down here in the middle is just me and my friend at Michigan State at a Model United Nations conference. I became the president of my club, and I do a lot of work now in Metro Detroit, helping at-risk students get access to Model United Nations speaking and leadership opportunities. And then I'm also an avid researcher. On the very right is me presenting research at Bethel College in Kansas. And then the bottom is me and my friends at a research program at the Michigan State University. I'm actually doing research right now. I am in South Dakota for an internship funded by the National Institute of Drug Abuse, where I do research on sexual assault survivors and psychosocial outcomes and coping mechanisms in terms of substance abuse. So that's been going very, very fun. I also had a life outside of my research and stuff like that. I love listening to music. The picture up here is me at the Eras Tour. Those are all my bracelets. It was a great time. And then I also love to travel. That's a photo of me in Alaska. I can't really escape my home state. Michigan is everywhere, I swear. But this slide is to show that outside of prevention work, that we're all students, our high schoolers, we're still kids, we have fun, we have passions. So this is just what got me started with the prevention work, like what ignited my passions. And just a little bit about me. So what actually got me started was during the COVID-19 pandemic. I was in the 7th grade, so I was 12, and I was itching to make a change in my community. So I helped found my own nonprofit with my sister, and we ran a bunch of different initiatives in terms of public health inequities. So we ran 3 American Red Cross blood drives at various institutions, and we did a local eyeglass drive to help the Lions Club. So we donated over 200 eyeglasses gathered from our school district and donated it to Americans who are in need of eye care. And some other big projects that we did were international, so helping female students in rural India get sanitary products, and then also helping visually impaired students who are orphaned get smart sticks, which are basically GPS and sensor included sticks, so students can go and get jobs after they graduate. And then in terms of policy, so this interested me in health inequity and initiatives. But what actually got me started in prevention work was when my school district chose me to be a part of our sexual education advisory board. So I was actually the only student who was chosen to be a part of this board. And I worked with OBGYNs, physicians, religious officials, healthcare administrators, and also advocates and mental health professionals to formulate a unique sexual education curriculum for my school district. And fun fact, our school district didn't even have a physician come and talk to students until this revision. So one of the main things I incorporated was having a physician come in and just being in that community and having that kind of impact. It was so inspiring, and I knew that I wanted to do this in the future. So I got started in my work with substance abuse prevention. I was searching for opportunities after working at my school's sexual education advisory board my junior year of high school. So I found the Prevention Network, which is actually a coalition based in Lansing, Michigan, which is their capital. And I got to reside on their advisory council, where I got to work with health advocates from throughout the state. I got to organize 2 advocacy days, one at the University of Michigan and one at Michigan State University, where I actually got to speak on research, because around this time was when recreational cannabis was legalized in Michigan. So there's a lot of changes going on, whether it be in high schools or communities or in the federal and state level. And so through this opportunity, I had the great experience to go to CADCA 2025, which is honestly one of the best experiences I've ever gotten, like point blank period. I got to visit the one of my state senators, Gary Peters, and talk to him. And I also got to meet with a bunch of different advocates. Public Health Cora to the right is a mental health advocate called Don Taylor. His speech was very inspiring, but this was kind of the turning point in my journey, because I actually got to be surrounded by a bunch of different youth who were passionate the same things I was passionate about. I know you guys in Ohio have Youth to Youth, but which is like a conference where all the youth in Ohio get to meet up. But in Michigan, we don't really have anything like that. So this kind of inspired my journey, and I did a lot of networking then, and I got to intern at a youth coalition in my city called the Alliance of Healthy Communities, and there I got to intern, speak on a bunch of different panels, help train mental health professionals. And that leads me into the work I started doing in college. So currently right now, I work with the University of Michigan for the Opioid Prevention Engagement Network, where I'm also part of the Youth Advisory Council. And right now, even though my term ended, me and my peers are working and formulating our opioid misuse prevention awareness toolkit that we created for our end of year project. And we're actually getting that published and spread throughout every public institution in Michigan. So whether that be hospitals, libraries, schools, etc. So we're in the work of getting that published throughout the state. And also, I'm continuing my advocacy work, not only in prevention, but also in other things in college. At the University of Akron, it's giving me so many great opportunities that I can never imagine. I became very involved in our student government, and I'm actually one of our leadership members. So what that means is I not only get paid, but I get a higher say in what administrators and students and the bridge between that. So in terms of policy, legislation, finances, all of that. And then I'm also an advocate in terms of residence hall activities. So I'm actually very involved in residence hall activities. To the right is a picture of me and my 2 peers at a conference in Columbus, where we got to meet with students from all over the country who are involved in residence hall activities to basically network and find comedians and activities to help students feel included once they come onto campus. So we actually got, those are 2 comedians in the middle, and we actually got them to come to our school this coming year. So it's a lot of pretty fun stuff. And then in terms of advocacy, in terms of prevention and substance use, not only have I been doing research in terms of mental health, reproductive health, substance abuse outcomes now and during the school year, but I actually got to speak at the Ohio Alcohol Misuse Conference this past March, which has been such a great experience. So you guys might have seen my face then, but I got to speak there and talk about my experiences and why youth are so vital in mental health. And from there, I got to speak at Susie's coalition. I saw she was on the call. I got to speak to her coalition about my experiences, and now I'm here writing this panel. So I really just loved connecting my high school experience with my experiences in college and growing upon my leadership. And all of these experiences have shown my passion for substance abuse, whether that be in my future career or whether that be now. So that was kind of a little brief about how I got to the place where I am today. Um, oh, and I have one more slide. So this is just what I did this past May. This wasn't in a prevention advocacy set, but I worked with the Cancer Action Society, and I was able to speak on a Senate committee and give my voice to to actually forming legislation in Michigan to increase taxes on vapes, which in every other state there's been taxes on vapes, but in Michigan there hasn't. So that's me with the senator of Detroit, the senator that represents Detroit. And yeah, so that's just me continuing my advocacy work. And now I'm just going to talk about the importance of youth. So youth know emerging trends before adults do. And that's why it's so incredibly important to have youth voice within prevention work, because youth voice isn't the future, it's the present. We are going now and we're experiencing all these different trends and issues. So if you guys are adults, in coalitions, make sure to get some kind of youth advisory board, to get some youth voice, so you guys have access to slang, different access points. You guys understand the social pressures, new substances that are in use, and unique behaviors that emerge. Because especially with the time of social media right now, term unique behaviors and social pressures emerge on the daily. There are depths of the web that not a lot of people even have access to that us youth do. For example, the importance of youth knowing emerging trends before adults do, and youth voice is important. Let's just say, for example, there is a coalition and they're doing work on THC, but little do they know students in their community don't actually struggle from THC, they struggle from vaping. So just getting that access to youth is so incredibly important. And adults often misinterpret youth behavior. I feel like every movie, TV show, and everyone has experienced this in this life, but having an angsty teen, and people are just saying, oh, she's just an angsty teen, but little do they know there's a lot of different pressures in high school and college environments. And I feel like coalition prevention programs from all the experiences I've seen are designed with youth have higher participation, trust, and retention. And this is actually supported by various research studies as cited by the Association of Child and Adolescent Psychiatric Nurses back in 2011. So that's way back when. There's been so many different studies that have proven that programs designed with youth have higher participation and trust and retention and improvement. In all the coalitions and councils that I worked in, I've seen that co-designing programs and initiatives are so vital and impactful. And that youth voice is partnership for the better tomorrow. And we aren't too young to understand prevention work. The people in this call range from incoming juniors to college students. And even my sister, I've talked to my sister who's 12 about this prevention work, and she's not too young to understand. And destigmatizing is, I think, the most important part of substance abuse prevention work, getting into those schools at younger ages and teaching students at a young age that vaping is bad, that drugs are bad, and that there are other ways to cope with the different traumas and stressors in modern day is so incredibly important. So this is just my little spiel about the importance of youth in coalitions. And now we are going to shift on to our youth panel, which I'm very, very excited about. If you three want to introduce yourselves. Nihar, if you want to go first.
Yes, hi. So my name is Nihar Patel, and I'm currently going to be a incoming freshman at the University of Cincinnati, and I'm originally from Cincinnati as well.
Hello, everyone. My name is Devon. I'm going to be a senior this year, and I'm originally from Columbus, Ohio, but I live more southeast.
Hi, I'm Gia, and I'm going to be a junior in high school, and I'm from like Central Ohio around Columbus.
Okay, perfect. So the first question I'm going to ask all of you guys is what first inspired you to get involved in prevention or advocacy work?
Yeah, so what first inspired me was actually through OILPN, where I attended one of the rallies, and I think if I could describe it in one word, it would be inspired. I came to the rally not really knowing what prevention was, or even thinking that prevention was something that I could even see myself even doing. But by going to the rally, seeing people my age be on stage and be so confident and speak on real issues, I really just want to be a part of something bigger. And through OLPN, I think I've definitely accomplished that goal.
For me, it was in middle school around like 8th grade, and my district has this thing where it's like like a leadership kind of workshop, and I went to it, and it was like a bunch of high schoolers speaking to middle schoolers about like prevention and stuff, and I joined that a year later, and I was just like, I was really surprised that I was really into it, and it was just really nice to be part of it.
And I'd say for me, one of my favorite lines I always like to say is one of my local prevention agencies that I had become a part of afterwards was it's called Agents of Change. And our advisor, she always says that no one ever goes into prevention like on purpose. They always just stumble into it. And for me, that's definitely true because I'd say around eighth grade, I wasn't really involved in school that much and I wanted to be. So one of my friends told me to join our local school's youth coalition where we do drug prevention and like mental health advocacy work. And I loved that first meeting. I enjoyed it so much. I stayed the entire year. And then that following April, we had a chance to go to the We Are Change rally up in Columbus. And while I was there, most kids just came because they just wanted to get out of school that day. But at least in my group. But I remember I had an absolute time. I was on the dance floor. I was learning so much. I was meeting so many different people. And then from there, I was able to join OLPN and then keep on doing the exact same work.
I definitely agree. I feel like a lot of youth, especially you three and all the people I've met, we've kind of all just stumbled into this, but the magic is we're
Mhm.
all still so passionate about it. So I definitely
Mhm.
agree with you guys. Moving on, what is one issue affecting you today that you're all really passionate about?
I think one issue that's affecting a lot of the youth today is through social media, it's very common to kind of just sit behind a screen and like cast judgment. Um, and then the effects on this is a lot of self-judgment and kind of just self-deprecating lines and habits and tendencies that you do amongst yourself, which I think is really becoming more common with social media. And I think it only negatively impacts how we perceive ourselves and in turn how we carry our lives.
Especially with the summer dawn, I would agree with that because right now most people like their screen time usage is going up, and I see so many people that I know usually aren't active, during the school year, and they're busy with work and other things, being more active now, and that I can see there's definitely a cost to that, and with Snapchat and Instagram and all these other platforms being used.
For me, I think a big issue is like it's like people because of social media, they're not just like connecting with their friends as often like in person, and they might and like I agree like their screen time's gonna go like way up. Like I know friends who have like a 6 hour screen time or like 8 hours. It's like really bad.
Yeah, I definitely agree. I think screen time is something I feel like students are getting phones at a younger age, like 6 or 7 or 8 or 9. They're getting at these young ages, and I feel like a lot of youth don't know how to actually utilize it for the better. I know I just said 6, 7. I'm so sorry, guys. Sorry, I had to say it. But it's definitely become a big issue because students usually fall into different social media trends, whether that be positive or negative. There's definitely a lot more negative than positive on the internet. For youth, there was a trend, it was called devious licks, and people would steal like sinks from like the bathroom, like it would be crazy
My
stuff. Yeah, it was not good, and people would get suspended. But that translates over to prevention work and substance use because students get influenced into substance use. They're like, oh, this is cool, so I'm going to do it. I'm going to get FOMO if I don't do it. So I definitely agree. I feel like social media really impacts all the facets that a youth struggles and experiences with on the daily. So the next question is going to be, what motivates you guys to keep showing up for this type of work?
Definitely just seeing people my age and other youth involved in different youth organizations, and even like the people here today who are on this panel that are brave enough to even come on the panel and speak on topics such as this. So I definitely um, gain a lot of hope for the future of prevention and just kind of the environment around me with when I'm seeing a bunch of youth, and not even just youth, but adults who are willing to kind of guide these youth in these spaces to create like a bigger impact and bigger change in the community. They carry on for the next generation after us.
I think for me, it's like not only just connecting with youth my age, but like youth younger than me. Like that leadership workshop I was talking about, it's like a bunch of middle schoolers, and I get to like talk to them about what's going on at their schools and what they think like the problem is and what like how they're trying to solve it. And I like that and just like connecting with everyone.
Yeah, I think for me, there has to be someone out there that, is doing like the right thing and has to be like kind of like the role model as well. And if you think about it, something I've learned recently is if you think about like all the youth and all the, people in the world that are, doing the wrong thing, maybe misusing they can be all like exemplified as like a black dot, but then around that black dot there's a lot of white space and negative space, and we have to be that white space for the people there.
Yeah, connecting with that, it's just people really do make the place, and whether you're showing it for people younger than you or people older than you, I think it's really the people and the connections that make us stay and make us really love this work. Connecting to that, in my research program right now, we actually got to meet with a lot of different survivors of substance abuse. So first, it used to be for me, the passion would be helping younger people, so people like my sister's age and youth. But now I feel like for me, it's really turned into older generations, so giving back because they really want to give back. Talking to these substance abuse survivors, they wanted to give back, and it's really nice that we're carrying that torch for them.
Mhm.
The next question is, was there a specific experience that changed how you viewed substance abuse prevention when working with the Prevention Action Alliance? I know we kind of brushed on this talking about workshops, but is there anything else that really struck out to you guys?
I remember one of the workshops I was doing, there was like, I think she was in like 7th or 8th grade, and she told me that she saw like a 4th grader vaping, and I found that really, really shocking. And I just like, that was one of like the main turning points in my head. I'm like, wow, this is like a big issue, and I really want to help do something with it.
For me, I think being from a more rural area, it's kind of hard to have the firsthand experiencing of like what's really going on around your environment. So when I was in different spaces and I would see just people like smoke or vape so casually, and then just the habit of like really needing some form of substance or nicotine, I didn't really see that in my own environment. So really seeing it firsthand was kind of an eye-opening experience as far as this wasn't something that I was used to seeing, and that this is actually real and this is actually a growing problem in my community.
And I think for me, it was kind of like the complete opposite because I mean, I'm from Cincinnati. It's a very big area, and I'm from Fairfield specifically. And I remember throughout like my entire childhood, just even being in like all of elementary school and middle school, and even just graduating from high school, I've always seen kids, vape and then try different products. If it went from vape pens to like Zins to like just different like flavors. And I live in a very like advertised area, like, and that's the main issue. Like many of the reasons, like our high school is right across from a drugstore, and most schools in this area and districts, I'd say, are right across or close to a very near convenience store that might sell those products. And personally, for me, it wasn't until like those things affect me in a way because I mean, there's peers around me doing it, but most specifically, it was back in like 8th or 9th grade. They shut our entire like restrooms down on the first floor because kids just kept on going and using in the bathrooms, and that was like the first time that I feel like it directly impacted me because it's like, okay, now I have to go all the way upstairs just because other students are doing it, and it's just a big cause in our school.
Yeah, I definitely agree. Again, not just social media, but just media that we consume in general. I feel like in the 21st century, we're just kind of just overloaded with media, with TikTok, with Instagram, but whether it be billboards. In my community, I came from kind of like a suburban area. So once Michigan legalized recreational cannabis, we started seeing all these signs like on our highways saying like free cannabis, next exit. So obviously students are going to be intrigued by that. So yeah, I definitely agree. Um, so how do you guys think today's youth culture influences attitudes towards substances and mental health? I know we brushed a little bit on this, but I want to know if we can dig deeper on it.
I think Gen Z, especially with social media and like platforms like TikTok, we treat everything like a trend. So when we see other people vaping or smoking, it's become so normalized in a sense that some people view it as if you're not doing it, you're not cool. And then there's the stigma behind like doing these things. You do them because you're older, you think you're cool, you think you're this, but and you want to follow a trend, but in reality, it's not cool just because you do that, and you don't have to do these things just to fit in.
I agree with that, but I also think there's like another side to it where like some people like see people vaping and they completely like shut them out and like think they're like bad kids. And like I think that that's like a stigma that we need to get over, and it's like people need to know that like they need to help people that are vaping, not just like shut them out and just not help them at all.
Yeah, and I kind of agree with both of you because at least in my school, our school had like a zero tolerance policy, and which that means that if you got caught using at least just even just one time, that you were automatically suspended for at least 3 days. And if you think about it, like most students, they're using most at home. Like yes, they do it at school, but they're doing it in secret. So they're being put back into an environment where they're just, more used to, like they're just around more smokers or just more there's more chances available to, use again versus instead being put into like a maybe like a Saturday school where they can at least maybe go through like a slideshow or maybe learn like the misuses and dangers of it. So just that kind of like that cycle and like that pattern of it being broken, they're just kind of just like redoing everything.
I think everything just comes back to destigmatizing. There's such a
Hmm.
huge stigma that we see every day, whether it be the zero tolerance policy, stigma against students who use it, and stigma against students who don't use it. I have kind of a college take on this. I know Devon was talking about pressure and peer pressure a little bit, and I want to add on that once young adults and youth enter into a college space, it's not the traditional peer pressure that we see on TV, like it's four kids taunting a kid to use it. It's more like you go and hang out in your friend's dorm and everyone's vaping and you're not, and then students feel like they need to feel included. So from a college point, I can really see that. But Gia, I definitely agree in a college point of view. I also see where students don't hang out and talk to other students because of their substance abuse. So definitely destigmatizing is something that we work on as youth and in our prevention work for sure. So why is it important for organizations to include youth voices in decision making?
I mean, most of the decisions that are being made affect youth, so then the most logical sense is to have youth included in those decisions so that they can be better suited.
Yeah, I agree. And also, would say that if people are speaking from like an older generation, not only are times different, but just different circumstances, different environments, just too many differences to be able to dictate or decide what's best for people in the current generation. So I think it's almost necessary to be hearing from youth and current people who are actually navigating the world in this current time environment and through all these different circumstances to actually know what's necessary and best for the youth of the current generation.
I agree because I think like a lot of the older generations, they've like grown up very differently because like the world's changing so fast. So it's really important to have youth voice.
I also think it's very inspiring for a youth to see other youth. Like I feel like personally I'm really inspired by Greta Thunberg because she's so close to our age, but she's doing so much great work with climate advocacy. So just seeing other youth speak, I feel like it inspires other youth to speak out. I think that's also a really large thing that I saw at CADCA, the Leadership Forum, and you guys probably saw Youth to Youth. You guys are probably really inspired by other students, right?
Yes.
Yeah, for sure. Um, so the next question is, how can adults better support youth advocates instead of just speaking for them?
I think the main thing is that like adults need to be able to listen to like youth and just instead of like speaking for them, maybe like let them speak for themselves, you know?
Yeah, I think the biggest thing is just listening. I used the word earlier, guided. A lot of organizations that I'm a part of are really youth led and adult guided. So it's always the adult just guiding the conversation, guiding the initiatives, and making sure that the youth are the ones making sure it's their input and kind of really their program. But also there are some things that are beyond a youth control, youth perspective. So always having that adult experience and adult guided input is also important.
Yeah, I definitely agree with both of you guys. And Devon, I do agree because I feel like things have to be youth led and youth understood because it's impacting the youth mainly. But at the same time, youth also need help and they need aid and they need to be aided at points where that's where the adult can, come in, swoop in and like rearrange the course and just help make sure the kids are staying on track.
I really like your point about adult support. So I just want to dig deeper on this conversation. And I want to ask you guys what communication approaches from adults feel supportive rather than judgmental when talking about prevention work?
To me, it's definitely when they ask, I think, follow-up questions versus, like making a statement. Like if someone says that idea, like that's a statement kind of, but it's like, oh, but what about that idea? Or, what about that certain thing? Definitely think, them asking follow-up questions makes me feel more included and more, like they're very interested in what I have to say and they want to, dig deeper with that.
I would say also when the adult is really excited to speak and talk on something that you're bringing up. Um, if you have like a good idea and then maybe the next day your adult ally is coming to you like, hey, and following up, kind of, I said following up and very motivated, enthusiastic about your idea. I feel when you feel that your idea is a good idea and then when it's encouraged by an adult ally, you're more likely to be influenced and be motivated to actually complete or do what you're trying to do, whether that's a project or a community initiative.
Yeah, I agree with you, Devon. I feel like when like the adult like encourages you to do something, you feel more connected to them too, and you're like able to share more stuff with them, and that makes you feel heard.
Yeah, I definitely agree. I think some of the common threads I've been hearing from you guys is support, encouragement, engagement, and definitely follow up. So showing that they care by doing follow up. I feel like I also see that in like high school counselors and advisors too. I see those qualities. So I definitely agree. Any support of adult, whether it be academic or it be prevention work, definitely show those kinds of traits. So the next question is, what's something you wish adults understood about Gen Z and prevention work?
I think just the fact that it's a lot different than like from when they were younger, because like vapes are just like so much more common now, and that's like the substance that most people, like most youth abuse now, whereas back then it might have been like cigarettes or like something else, and it's just like they need to know that it's changing.
For me, it's something like that there's so many youth that still care. Like I know, like we're in like the world of social media and AI, and many adults are just like, oh, every single kid, they're just so dependent on things, and just most kids vape. But there's so many youth that work together that are still, like still in for like the good fight as well.
I feel like older generations, they see like these very hyperbolic commercials and statistics, but in reality, yes, there is a lot of youth using substances, but there also is a lot of youth advocating and fighting against substance use. So I think there is a huge stigma around substance use, but there also is, like I said, a lot of positive peers and positive youth who are actually fighting against that substance use.
I really like how you guys talk about there's students in the good fight as well. So I'm just curious, how do students in high school actually talk about mental health outcomes and substance abuse among themselves? Like, and what do professionals often miss about that language? So how do you guys communicate about it? Because I feel like we've talked about how we work with it, but how do you guys communicate with your peers about it?
I know for me personally, like our school, we have a large school. Just in my grade alone, we have close to like nearly 1,000 kids, and we have lots of like programs. Like we have Hope Squad, and I'm actually involved in my school's Hope Squad too, where many youth and we have like over 40 members in our Hope Squad too. So many of the youth that may be struggling, if they don't want to talk to an adult, they can always come and talk to us, and it can even be in like a whole like, lament setting as well. Just like one on one or just on a phone call. And I know that's at least those different programs and clubs. Like it doesn't even have to be like a Hope Squad club. Like I know our school is very involved in like cultural clubs as well, and many of the students come there and they talk about their issues as well. But they also enjoy something new about the school.
I think for my school, it's like also the same. We have a Hope Squad, and we also have this thing called Teen Institute, and that's through all the high schools and through the middle schools. So I feel like when people talk through that club, they feel more connected to the like entire district as a whole too. And just the fact that they're like able to come and talk to youth instead of like maybe they might be too scared to talk to adults. So maybe like just go to clubs and talk to other youth.
Yeah, and I would just have to agree. I would also say it's a lot of talking through different clubs and youth initiatives at my school. And also just talking about substance use and all these different things in third spaces that really isn't work or school. Um, because I feel like a, a lot of youth really, when you are at work, you're focused on work, or when you're at school, you're focused on school. But if you go to a third space like a library or just a public space to really talk about an issue or problem that's going on in your school, I feel like that's the best time and the best time to speak on the topic. And yeah.
I definitely agree. I really love all of your guys' answers about communication, whether it be in third spaces or whether it be through school organizations. I think something that I saw when I was in high school is that people would talk about it through media. So whether that be movies or TV shows. Before we hopped on this call, Max was talking about Euphoria and how in my school, at least, I came from a very academic oriented high school, and it was like 120 of us per grade, and we would talk about Euphoria as like some like made up TV show. So like talking about media, like talking, we would talk about it through avenues of like TikTok, like, hey, did you see that TikTok? Like that was crazy. Like stuff like that, just like common talk. Like it doesn't have to be a heart to heart at a library. It could be just a casual conversation in the cafeteria. It can honestly happen anywhere and everywhere. So yeah, I really liked all of your guys' answers. The last question that I have for you is what's next for you guys in your advocacy journey? I know Nihar's going into college, Devon's going into his senior year, and Gia's going into her junior year. So what's next for you guys, whether it be transitioning into a different institution or doing college applications, stuff like that? What's next for you guys in your advocacy journey?
For me, yeah, I'm going into my senior year. It is very stressful as far as the college application process, but as far as prevention, I still want to just continue doing the things I'm involved in, keep doing my advocacy work, keep speaking at different places, and keep advocating for prevention, but also working against my own personal life, where that is college applications and just preparing myself for even college next year.
I agree. I want to continue doing some of the same things I've been doing and through the clubs I have in my school. And I just like, I'm going into my junior year, so I know that's going to be a lot of stress. So I want to be able to like work through that and just, yeah.
And then for me, I guess I'm in a pretty weird transition period because it's like I just finished all my school organizations, but I'm looking at different opportunities that UC has on campus. Like it's a very large campus. There's like over 50,000 students, and we have over 750 different organizations. And if there isn't like a right program for me, I can always like create my own like club or something. And speaking of that, I'm not sure why Devon didn't mention it at all, but he also started Spark Impact, and I'm one of his co-founders, and it's basically an organization that connects students across Ohio, but you're hoping to reach out to the entire nation too, with just different opportunities and different advocacy work as well. So I think you forgot to mention that, Devon.
Devon, do you want to speak on that a little bit more? I feel like everyone would love to hear about it.
Okay, yes, of course. So, Spark Impact, this is an idea that I've had for a while now, but I've really just started to make it more real. At Y2Y, which Youth to Youth International Conference, I spoke on it more there. But essentially, what Spark Impact is it's currently a website and we have a social media, but the end goal is to really have an app because the target audience is youth. And with social media being so big, I feel the easiest way to connect with other people is through your phone. So how Spark Impact would work is essentially our motto is spark it, scale it, impact it. So spark it means just an idea. Every good initiative starts with an idea, and scale it means finding the resources, the community, and the peers to turn your idea into actual reality. And then impact it, that is sharing your ideas with people from all across Ohio. And Spark Impact right now has people from all across the nation. Actually, we have people from Michigan, Vermont, and all other states across the nation. And then how it would work is you would submit a spark, or which is essentially an idea or initiative that you're bringing. Then we would feature that on Spark Impact and we would showcase it. But we wouldn't just showcase the initiative you're doing. We'd also show how you did it and the resource put into that initiative. And then so it's broadcasted and shared through everyone who uses the app so they can see initiative from all across the nation, and then they can recreate that change and bring it back into their own communities. So that's essentially what Spark Impact is.
So we have a question from the chat. Someone is asking, how do we join Spark? Is it for youth only or also adults?
Yeah, so it's also for adults. It's for any um nonprofit, school, organization, club, or just different um youth leaders. So how you would get involved is we have a social media Spark Impact app on Instagram, which is the forefront of how we're kind of marketing and getting different initiatives involved. Um, I know with it being the summer, there's a lot of school organizations who do a lot more during the school year. So right now we're just trying to get as many nonprofits and organizations involved. So definitely if you do want to get involved and if you are an adult, just message Spark Impact app on Instagram, and we can talk further on that.
I think that's a really great way in getting prevention work, not just prevention work, but all types of nonprofit and prevention work to a larger scale. So people from Florida can learn about the stuff that we're doing in Ohio. Like, I think that's very, very great. So good job to you guys. So now we're going to transition into any Q&A questions. Does anyone have any questions in the chat to ask our youth? Anything at all?
Awesome. Thanks, guys. So I do have a question while people are putting in some questions into the chat. Devon, you mentioned third spaces, and this is a term that's a little bit newer for me. I only heard it like probably a year ago. Could you explain what a third space is and what kind of third spaces exist during the summer for you guys? Because you mentioned like the libraries and stuff during the school year or whatnot. I know libraries are during the summer, but for someone like you, Devon, that's in Appalachia and might not have direct access to a library, what kind of things are available to you guys?
Yeah, so being from a more rural area, rural Appalachia, it's transportation is a big factor. So a lot of things or third spaces or traditional third spaces that people go to, like libraries, or even what we do is pickleball courts. It's a little bit of a drive just to even get there. But third spaces are really important because it creates obviously a space that's not either work or school where you can just go out and really just hang out with friends, and it gets you um out of a space or mindset of boredom, and boredom really drives and fuels the want to kind of explore. And a lot of students or youth explore by picking up a vape or doing things like that. So finding a good third space to be at, especially during the summer when there is no school or maybe you don't even work, it's important to find a third space so you aren't exploring and you aren't experimenting, but you're still finding a space where you're hanging out with friends and having fun.
Nihar, do you have anything to add on that, or Gia, because you guys live in more suburban, urban areas, does that change? Does that third space kind of change over the summer? What do you guys have to add on?
I'd say for me, it usually just gets more expansive because in the summer, I mean, being in Cincy, there's lots of other opportunities that are open. Like I know tomorrow our local mayor is hosting this. It's a fundraiser, but it's free for all youth. It's this painting birdhouses activity that I know most of me and my friends are going to from 12 to 4. So just being in the summer, there's lots of opportunities here, just in Cincy at least, for third spaces and just for opportunities for us to go to and do in the summer.
I agree. I think that there's like a lot of like activities and stuff that like just the neighborhood puts on during the summer that we can go to, and just like even just friends hanging out at like other friends' houses or just like going to the mall or something. I feel like that could count as a third space, and like people are just like free to talk and like spend time with each other outside of school and work.
I definitely agree. As a college student, I definitely in high school I did all those things. I think in college it kind of changes. I think during the school year it could be your dorm, it can be a restaurant, it can be the dining hall. Into the summer, I feel like a third space can kind of become FaceTime, right? FaceTime, text messages, like just reaching out to your friends and talking to them. I feel like we have our phones and we use them so much to communicate with people that that could almost become a third space. So I definitely agree with all of you guys. We do have a question from Kathy in the chat. She says, I teach substance use prevention in various schools. Do you guys have any advice on how to talk to the teens about substance use without sounding judgy? That's a good question.
I'd say for me, try to like relate it to like the youth because I know you said in various schools, so I'm just gonna assume like middle, high level. Um, Without sounding judgy, I would say, try to like relate to them, maybe make a presentation more engaging by just connecting it to social media. Because I know that's the one way to like make things not sound judgy is by relating to students and their social media usage.
My advice would be to kind of be more empathetic. Maybe a lot of youth who are using kind of don't come from the best place or environment. And I think that older generations, they really pushed kind of the fear factor. And now that's carrying over into our generation. And then for the people who are from worser backgrounds or environments and they are using substances, now they have a negative connotation. And really, it's not really always their fault or reason why they are using. It's just something that was just so common in their area and they happened to do because they really didn't have a third space or they didn't have a peer to tell them that this isn't something that they should be doing. So I think the approach you can do is obviously, like Nira said, is being understandable, but also being empathetic towards their situation.
I agree, and I feel like one big step for that is like trying to talk to them not as like an adult, but more like someone who's like an equal and just like on their level, kind of like a friend almost.
Gia, I love that you say that. That's something that I'm always telling people is when working with young people, don't treat them like adults, don't treat them like kids, treat them like people and humans. That's all they want. That's all they need is just to be able to have that conversation. And one suggestion that I would say is when working with teens is ask them about it. If you're having a conversation about vaping, ask them their experiences and what they are seeing and hearing. Have them kind of figure out these answers by themselves, like through an open conversation. By having an adult ally lead that conversation, they can really figure that out.
I have a follow-up question to third spaces, but first, I couldn't agree more with Max. I think having open conversations with young people, I think young people's environments are very impactful to them. And I'm talking environments that are led most of the time by adults. So, what are they being exposed to? Because that matters. But my follow-up question for third spaces. One, I guess it's a two-part. One, how can adults help support third spaces for young people? And two, if adults, would you want adults involved in any way, shape, or form in your third spaces, or just playing a supportive role of like, we can help make this third space happen. After that, we'll step away. So I guess my ultimate question is, how do you see, if at all, an adult role in those third spaces that you guys hang out in?
I think that's a good question. I think it would just depend on, honestly, each person really, or the space that it is. I feel like that's a good question, and that I think personally that adults should or can be involved in third spaces, but I think it would just depend on what that space looks like and if the youth are even willing to. Because I know some third spaces aren't even the talk or really focus on prevention. Maybe sometimes it's just a break. So maybe sometimes people don't want an adult ally in their third space, or maybe some people use their third space to actually talk about prevention and other things that they couldn't really talk about in their school or at work.
I think for me, it would definitely be a case by case scenario because, each person's different and each person's maybe comfortable having an adult in their space. And some people aren't because, it's more private. And I guess it would depend. But also what Gia was saying earlier, like if you're hanging out at a friend's house, maybe the adult can, make the space comfortable or, just ask like, what do you need? Like the most simple way to ask, or that's like the most simplest way to, find out what a person needs is just by asking.
Yeah, I agree. I think that also like a lot of times youth go to third spaces to maybe like get away from adults, not in like a bad way, but just like to be with their friends. So it just depends on what they're trying to do and just like what their opinion is on adults and but yeah, basically.
Something that I'd like to add. Oh, sorry.
No, go ahead. Go ahead, Shree.
Something I like to add was when I was in high school, there was always this corner that me and my friends would go to with a lot of pillows and a lot of like posters and stuff. So like maybe like schools and different prevention alliances making their in-person spaces like more comfortable with like pillows and like needles and like stress toys. Like just like that comfortable space is what students really like love. Especially like when I always talk to my friends and have like kind of a difficult like conversation, they always like to go to a very comfortable space. So just making it comfy.
I appreciate the honesty, guys. Yeah, sometimes you just don't want adults in your third space, and that is fine. Um, more than fine. So thank you for your honesty in answering that question. And I'll take that and put it in my pocket.
We love
I
you, Juliana.
also love though that when you do have youth-led youth, you know, not having an adult in the space, like they're still having that influence of healthy lifestyles and things like that from the youth-led youth. And so like I think that's a much better way to reach out to youth who maybe aren't in these spaces and getting them into the third spaces without the adults, but with the youth-led peers.
That's a great point. You guys are the positive peer role models out there and able to encourage people to have healthy, safe lives without any substances or anything like that. Thank you all for doing this today. You guys absolutely killed it, and I think gave some really great insights.